Does scribing count for clinical hours? I've heard some schools don't count it because it isn't typically hands-on like an MA. So I'm assuming this person is again asking for PA school, patient care experience, PCE hours. So the hours that are a requirement, some schools require 1,000, some 500, some 2,000, they vary. But all PA schools do require at least some number of patient care experience hours. Usually people get them with a lower level medical job like an EMT, CNA, scribe, medical assistant, that kind of thing. However, some of them do require completely hands-on. You're actually doing stuff hands-on with patients. You have some level of responsibility for patient care, and you're not just scribing, you're not just completing charts, you're actually hands-on. Technically, scribes aren't allowed to do anything hands-on, usually. So, not all schools take it. Do I think it's excellent experience? Yes, I myself was a scribe. A lot of people who went to my PA program were scribes, but some schools do not take it and some do, so you need to research that. Now, I'm gonna make this video just a little bit longer by saying that I do think everyone who wants to go to PA school should do at least some time scribing. The reason for that is because I feel like I learned the most about medicine as a scribe. I learned bedside manner, I learned more hands-on type stuff as a medical assistant because I was alone in the room with patients doing my own thing that I had to do as a medical assistant. However, I was actually a medical assistant, a CNA, and a scribe during different parts of my pre-PA journey. But all of that being said, I'm going to say that as a scribe, I definitely learned the most medicine, the most medical decision making, the most about healthcare, and the most about like the provider role. Because think about it, as a scribe, your job, you're actually like right next to a provider the entire time, and you're typing out what they're thinking, what they're doing, the things that they're ordering. So you're actually like you're not a provider, obviously, but you're right next to the provider. You're kind of provider adjacent, and that's who you spend the most time with. As a CNA, you're doing CNA things and maybe reporting to a nurse. You're not spending a whole lot of time with providers at all. As a medical assistant, you have your medical assistant roles. You might talk to the provider pretty frequently, but you're basically just kind of taking orders. You're doing your MA stuff. You're not really there for the medical decision making and like the reasoning why the provider's doing what the provider's doing. As a scribe, you're there the whole time the provider is doing what the provider wants to do, and you're seeing that for hundreds or thousands of patient presentations, and you're learning all that stuff. And maybe if you have a good provider, they're even teaching you stuff. So I think scribing experience is absolutely invaluable if you want to be a provider, whether that be a PA, an NP, or a doctor. So a lot of people going to medical school, going to PA school will have those scribe hours. The caveat there is if the school you're applying to does not accept scribing hours, I still think that they're good to have, but just to meet the requirement, you're going to need something like a CNA, a medical assistant, something else that's more hands-on. So unfortunately, some PA schools do not count scribing as patient care experience. They might count it as medical experience. But I'm pretty passionate about the fact that scribing is very, very good experience, especially if you want to be a provider. So much though that I'm taking 3 minutes out of my little lunch break here, my yesterday's Chipotle. I'm taking away Chipotle time to tell you guys about scribing. So that's how much I love you guys, and that's how much I think this is an important thing to discuss. So yeah, no extra charge for that. But yeah, so I'm gonna go back to my Chipotle, and I really hope that answered your question. Have a great day.